We begin at 5 with the latest on the Delta variant. The CDC has now placed much of Northeast Ohio in the orange category. That means substantial transmission. Ashland County is actually now red. That means high transmission. Summit and Ashtabula counties remain moderate.
Well, the big question is, of course, what does all that actually mean? And of course, that means senior health correspondent Monica Roberts joins us to break it all down.
It means I got to take the long walk from my desk into the studio. Yeah.
Day after day after day.
Okay.
We're glad you do.
Yeah.
Thank you. So we are seeing more counties popping up red to the west and south of us. I spoke with Mark Adams, the Deputy Health Commissioner for Lorain County, who told me we need to look at the CDC map like a lighthouse. It's warning us that the virus is out there and spreading more, but we also need to keep an eye on our hospitalization rates, and they're still pretty low. That said, 99% of those getting hospitalized are unvaccinated. So that's who's most at risk.
Vaccinated person to transmit to another vaccinated person, the chances would be winning the lottery. You'd have a better shot at that, or even getting struck by lightning. When you throw an unvaccinated person in the room, it's not that the vaccinated person is not really going to experience that bad health outcome. The data is not there to show that, but the unvaccinated person places themselves at risk. And while they have the chance to do that, if that's what they want to do, it's just not smart.
So the White House COVID task force having a press conference right now indicating again people with Delta variant have a higher viral load and are more likely to infect more people. Last week, the state updated me on hospitalizations and deaths between January 1st and July 28th. Ohio is reporting 245 breakthrough hospitalizations and 62 deaths among fully vaccinated individuals. Compare that to 17,210 hospitalizations and 6,828 deaths of the unvaccinated. So I don't know how you compare these numbers any more simply than that.
We were talking before the show. When you look at just that set of data, it is so obvious that the shot is your best protection against this. On that note, I just read a moment ago that the United States is now at 70% vaccinated, which is great. Unfortunately, we lag far behind that number here in Ohio. But here's my big question to you. You mentioned that hospitalizations and deaths in Ohio are down. But last week, we reported 3 straight days with cases over 1,000. That's considered a surge because our numbers were so low. Is it just a matter of time before we see those hospitalizations and deaths tick up?
We are seeing a slow uptick, but thank goodness it is a slow uptick. I think today the number was like 130 people hospitalized right now in the entire state.
Right.
The problem is we know that Delta is out there. We know it's surging a lot. And I think the other issue is that a lot of people are way more aware of it and they're getting tested. Billy, we were talking, Billy has a sneeze or a cough, they're going to get tested, and we're finding more cases. The good news though, you know, here in Cuyahoga County in Northeast Ohio, our vaccination rate is a bit higher. And don't forget, all of those people who've had COVID add to our herd immunity.
Sure, yeah.
So that's something really important to keep in mind as well.
And still waiting for the little kids to be able to get a shot too. That's the next step.
Hopefully end of September.
All right, fingers crossed, yeah.
Thanks, Mon.
Sure.